Alrighty, welcome back to Kearsarge Valley Magazine. I am Adam Brisbine, standing with Dr. Steve Coppola here at Coppola Physical Therapy in Concord. Doctor, thank you for joining us.
Love being here.
All right, we're going to talk about something that affects a lot of people, and that is neck pain. And before we get into the real nitty-gritty, who does neck pain affect more, men or women?
You know, for some reason, it's women, and
Okay.
there are a lot of theories out there, and some people say it's hormonal. My theory, and I think it's a true one, is that a lot of women more have static postures. A lot of them having to sit at desks, and then not only do they sit in a static posture, but then they go home, and sometimes they're in charge of doing all the repetitive tasks at home on top of that. So they kind of do double duty, and you know, sometimes maybe us guys slough off a little bit. So
it's a man's fault.
It is again, yeah, exactly. So I'd say it is women predominantly that come in, but obviously it affects both.
All right, so you're not only doing physical therapy, you're helping out the women's liberation movement as well by saying that.
I guess I am. Yeah, I guess I am.
Well, let's talk about something that can help fix these things, and not necessarily something that costs a lot of money or takes a lot of time. You talked about a lot of women tend to have more office jobs where they are sitting a lot behind a desk. What can somebody do while they're at work to help with their neck pain?
At work, it's important that we try to adjust their environment, okay? That they're sitting straight forward at the computer. That's important to do. That their feet can actually touch the ground. That's an important thing to do. But one of the biggest things that happens is posturally. As you end up sitting in a chair, and maybe actually, if you want to, you can sit down.
Sure.
As you sit in a chair here, what tends to happen is people slunch over, okay? These muscles in here get very tight. These muscles here, the upper trapezius, get very tight too, Adam. And then you're looking up towards a computer, and look, you're just really feeding into the posture. People have a mouse on their right-hand side, so this right shoulder is even pushed forward even more. And so there's really a lot of times not only do they have neck pain, but they have pain that goes right down into the right side of their shoulder. So posture is really important. One of my little 59-cent fixes that I love, my little 59-cent towel, is that you can put this, actually, a lot of people say put it in your low back this way into your back and give you a little lumbar support. It does. But I actually like it even better, personally, is when I put it up and down into the back. And now what that does is it not only fixes down below, but it makes you press. That's right. It aligns your whole body kind of up and down a little bit better there. It's a little bit more comfortable. It's a little reminder to this part of your spine to sit up tall, and a lot of people get a lot of relief from that. You just tie that right under your chair, so you don't have to have the big expensive chair.
That's great.
Even at home, people spend a lot of time on the internet now, a lot of time doing emails. Great little easy way to take their cheap chair and make it something that's a little bit more ergonomically correct for themselves.
59-cent fix. There
59
you go.
cent
Can't
fix.
get better than that. Now, the one other thing, too, that we have to talk about is sleeping. Another thing you'll see that's pretty
neck pain
big
at
now
night
is these huge pillows and these different things. You can actually take that towel, the same towel that you used at work or at home, and do something with your pillow. Yeah,
you could. And I think it's, again, another little 59-cent fix. Roll up a towel. Really just put it down on the inside, on the bottom of their,
oh, excellent.
Put it down here. Now, you can adjust this, right? If that's too high for you and you lie down, then you want it so that it maintains your neutral part of your spine, right? You don't want to be like this at night, and you don't want to be like this at night. You kind of want to figure out what's neutral. So you roll that accordingly. Excellent. And you need to unroll it a little, you can unroll a little, but you can play around with it. A lot of pillows, they're set one way. When you buy it and you spend $90 for it, it's a certain way, and that's the way it is. This you can adjust for it, and it's economically correct.
Yeah, and not that the other pillows and stuff aren't bad. This is just a different way of doing it.
Great cheap fix. You don't know if it's going to work for you or not, so this might be a great starter way at least.
Okay, well now let's take a look at something that somebody can do maybe when they get home from work that kind of relaxes the neck a little bit and eases some stuff.
Sure.
So now this is actually one of the exercises that we just talked about that somebody can do at home.
Yeah, Adam, and this is, again, I think I explained it before, not as much of an exercise as it is a way to unweight the neck and give it a chance to kind of relax and feel better. It's pretty easy to make. Obviously, it's just a towel that's been tied to a rope, and the rope's been tied to the door, and I've put a do not enter and lock the door on the other side there. But it's really neat because, you know, you're compressed all day long. This is a way to kind of pull apart your neck a little bit very gently. Gotcha. It unweights your neck. If I slide down towards my feet a little bit more, I can get a little pull, which actually distracts my vertebrae a little bit and lets those discs breathe a little bit. And people can lay like this for 15, 20, 25 minutes. and really does work and works well. It's a nice little home 59-cent fix. I love those.
But the most important thing is obviously to put the do not enter.
Yeah, probably.
Because then you got a whole nother neck issue if somebody comes flying in there.
Absolutely.
All right. Well, we'll take a look at some of the other stuff too.
Sounds good.
All right. Now we've seen what somebody can do at home and in their office. What actually, so that you don't go out of business because you're giving all these great tips away. What can you do? What can the physical therapist do to help with neck pain?
Going out of business, too much pain to be out there.
Yeah.
I'm all about giving people what they need.
Yeah.
In terms of physical therapy, sometimes people come in and they have a lot of pain in physical therapy. What we like to do is use our modalities that we've talked about in our other segments, and then we try to even do manual traction, really try to spread open the spine and give that room to breathe. And then sometimes we need to do joint mobilizations to actually help move every single joint in the spine, to increase that mobility and the flexibility. Then we actually need to strengthen the areas around the neck and actually even down lower at them. We think that all the time we need to strengthen the place, but sometimes other areas need to be strong, so it compensates, take the pressure off these upper trap muscles. These upper trap muscles get so strong because we use them all the time. We actually have to get the other muscles working so the upper traps don't have to work so hard.
And those are the muscles that when somebody gives you a neck massage, you're like, oh man,
That's
does that
right.
feel good?
That's
what
right.
those are the
those
muscles
that get
that
so
they're
tight causes those pains that go up into your neck, and these little muscles are shortened. So we really get people to strengthen other muscles sometimes that help to alleviate the pain there.
Cool. Well, thanks once again for so much tremendous information. Obviously, you said pain is a big part of a lot of people's lives, and this is just one of the small steps that they can do to kind of help the well-being of their life. So thanks for joining us. Somebody wants some more information on this stuff and how to get in contact with you. Maybe they have some physical pain. How could they do that?
They can give me a call at 603-228-7500, or actually, if they want to check out our website, there's a Contact Us page on there, www.coppolapt.com. They can check out our website, and they can certainly shoot me an email.
Okay. Thanks for joining us.
Thanks for having me.
Back to you.